Dear student, I am Dr. Prakash Mungli, Professor of Biochemistry. In this lecture, I will be going over thalassemia syndromes. Especially, I will be concentrating on alpha thalassemias. Now, insufficient production of structurally normal alpha or beta globins may lead to thalassemia syndromes. And thalassemia is one of the most common single gene disorders. And commonly, thalassemias are seen in African, Asian, Mediterranean or Middle Eastern descent people. And thalassemia is more prevalent in regions in which malaria is endemic. It's because in thalassemia syndromes, the RBC lifespan will be drastically reduced, and that is beneficial for people who are living in malaria endemic areas, because malarial parasite, it will thrive in the red blood cell, it will generate its progeny or it will complete its life cycle in the red blood cell. So when the red blood cells are dying too frequently by having thalassemia syndromes, it is an advantage for protection against the more dangerous disorder, that is malaria, especially the falciform malaria, which will lead to cerebral malaria. Okay, so individuals with beta thalassemia syndromes have somewhat better protection against malaria than individuals with alpha thalassemia syndromes. The alpha globin hemoglobinopathies are symptomatic starting from in utero and also starting immediately after birth, whereas infants with beta globin hemoglobinopathies, that is beta thalassemias, they tend to be asymptomatic until they reach 3 to 9 months of age. This is one of the major difference that you see with alpha thalassemias when compared to beta thalassemia. So alpha thalassemias, they manifest in utero and soon after birth, whereas beta thalassemia patients, the symptoms will start from 3 to 9 months onwards. Generally, it is not seen at the time of birth. So remember that point, so that you can differentiate based on the appearance of signs and symptoms or age of onset of the disorder. So we can differentiate which type of thalassemia it is, whether it is alpha thalassemia or beta thalassemia. So these are some of the points that will help in the diagnosis. First thing is the epidemiology, that increased frequency seen in African, Asian, Mediterranean and Middle Eastern people. And also the other is age of onset. Look for that. Now coming to alpha thalassemias. There are 4 copies of alpha globin gene to make 2 alpha globins that are needed for synthesis of a hemoglobin molecule. And these 4 copies are present over chromosome number 16. And based on the mutation that are going on over these 4 copies of alpha globin gene coding for sufficient alpha globin synthesis, so if 1 out of the 4 alpha globin gene is deleted, it will give rise to silent carrier state, that is referred as alpha thalassemia 2 trait. So this type of disorder do not manifest with any clinical signs and symptoms, because when 1 of the 4 alpha globin gene is deleted, just still there are 3 alpha globin genes which are present. So significantly useful hemoglobin is synthesized, because 75% of alpha globin is still synthesized by 3 genes which are coding for alpha globin. So useful hemoglobin is made. So there is no signs and symptoms seen. Coming to alpha thalassemia trait. This alpha thalassemia trait is also called as alpha thalassemia 1 trait. And here 2 globin genes are deleted out of 4. As you see here. So that means a patient will show only 50% of alpha globins which are made from 2 normal genes which are coding for alpha globin. So that's why patient will show mild anemia and mild enlargement of the spleen. Now let's move on to see HBH disease, that is HBH beta 4 disease, which is also referred as thalassemia intermedia. So in this particular disease, there will be 3 out of 4 alpha globin genes are deleted. That means only 25% of alpha globin is synthesized by one normal gene, because out of 4 genes, 1 gene is remaining and 3 genes are deleted. So that means only 25% of alpha globin is made and rest 75% is not coming. That's why only 25% of these alpha globins will bind with 25% of beta globins, which are normally synthesized in 100% quantity. Only 25% of the beta globins can be used because we have only 25% of alpha globin is coming. So that's why 25% of normal hemoglobin is produced. So the rest of the beta globins, which are not getting alpha globins to bind with, so they associate with one another and they will make beta 4 tetramers, and they are referred as HBH tetramers. And these beta 4 tetramers, they form an inclusion bodies, and these inclusion bodies are toxic to red blood cell, and that's why it will lead to moderately severe hemolytic anemia, and also there will be milder ineffective erythropoiesis. So it is an intermediate type of hemolytic anemia is shown, and that's why it is called as thalassemia intermedia. Coming to the fourth type of alpha thalassemia, it is hydrops fetalis with HB Bart's gamma 4 thalassemia. So also referred as alpha thalassemia major. So here all 4 alpha globin genes are deleted. No physiologically useful hemoglobin is produced because no alpha globins are available. And note that alpha globins are necessary starting from the fetal life. To make even fetal hemoglobin, there is a need for alpha globin chains. So that's why in the absence of alpha globins, the gamma globins, which are synthesized in normal quantities, they all will associate with one another, making gamma 4 tetramers, which is referred as HB Bart's gamma 4. And these gamma 4 tetramers, they have high affinity for oxygen, and they will bind with oxygen with such a high affinity that no oxygen is released to the peripheral tissue. So it causes tissue hypoxia, massive body edema, and that is what is referred as hydrops fetalis. And with high output congestive heart failure due to severe anemia. And they also have massive hepatomegaly due to heart failure and extramedullary hematopoiesis, and usually death occurs in utero. These are some of the consequences of having no useful alpha globin chain and excess gamma globulins, which are forming gamma 4 tetramers having higher affinity for oxygen. So these are the 4 types of alpha thalassemias depending on the number of genes that are deleted, which are coding for alpha chains for hemoglobin formation. Now there is a type of alpha thalassemia referred as alpha thalassemia mental retardation syndromes. So the mild forms of alpha thalassemia in conjunction with mental retardation is referred as alpha thalassemia mental retardation syndromes. There are 2 clinical entities seen in this category. One is ATR16 syndrome, other is ATRX syndrome. In ATR16 syndrome, the large chromosomal rearrangement involving short arm of chromosome number 16 telomere is seen. Patients will show mental retardation, although the major signs and symptoms are not seen. Whereas ATRX syndrome, it is an X-linked recessive disorder caused by mutations in ATRX gene located on XQ13.3. So this leads to down regulation of alpha globin gene, and along with that there will be mental retardation. Skeletal deformities are seen in as many as 90% of patients. So this is what is alpha thalassemia mental retardation syndrome. And finally, we have another alpha thalassemia associated disorder called alpha thalassemia myelodysplastic syndrome. It is a severe acquired form of HbH disease which may occur in elderly men with clonal myeloproliferative diseases. So, patients with this syndrome will show marked hypochromic microcytic anemia. So, that's all about thalassemia syndromes and more particularly alpha thalassemias and alpha thalassemia associated syndromes. Thank you.